Sweet, Dr. Kimia, we're finally on. And we were just chatting about this, but like, you know what I mean? It's such a shocker when you finally start practicing, and then it's like, wait a minute, we were like, I was living right next to the school, and now I live so much further away from the practice. So anyway, yeah, you're in Comac, but you're also in Astoria and
Levittown on Long Island. So right now I'm at Levittown and Comac, but I live full time in the city. And I was just saying how originally I was, living on Long Island and the city. So during the week when it was convenient, I would stay on Long Island, and then on the weekends I'd mostly be in the city. But now I'm full time living in the city, commuting to Comac, which is pretty far.
yeah, and you're going a little bit against traffic, not with the traffic. So like against traffic is
But
like
there's
okay,
so
so
much
it's a little bit
traffic.
later.
There's so much traffic.
You do the LIE Northern State, probably LIE 2 Northern State.
Yeah,
And how
exactly.
long is that, like on
So
average?
it's like an hour and a half each way, average, give or take
Oh
20
my
minutes sometimes.
God.
Yeah. I really do love where I work, so I feel very grateful.
Yeah.
But it's a long commute.
It's a really long.
Opportunities.
What do you do? What do you do in the car that whole time? Like 7 podcasts?
Yeah, no, actually. Podcast,
What do you
phone call.
crime junkies?
Sorry?
Crime junkies?
No. If you have something
No?
good, I'll check that out, but let me see. I could check right now what my list is.
I'm just curious. Yeah, no, that's a
There's a lot.
long commute. How many years have you been there in Comac?
Like 3.
But it's just recently. It's this last, what, 6 months, a year? Have you been coming out from the city?
Yeah, so I lived in the city in the beginning too, but I would stay on Long Island a lot. But yeah, since March, I'm full time in the city.
6 months under your belt. That's just, man, an hour and a half commute each way, 3 hours of your life. How do you find time to work out?
I know. It depends on my schedule, but sometimes I work out before or after work. But it's more tiring, it's not that ideal, I would say.
And how many days are you in Comac now that I'm thinking about it?
I'm in Levittown 1 day a week and then Comac 3 days a week. So right now I'm working pretty much 4 days a week.
Okay.
And you just started around Comac, right?
Yeah. I'm in Millville. It's compared to Comac, that's like what, 10, 15, probably like 15 minutes maybe.
How is that?
Good. I think I see a couple of your patients here and there.
Yeah, for sure.
Yeah, hopefully they like me. Some of the moms can be tough. Some of them can be tough. Do you feel like that? Do you ever get that or no?
Definitely, but I do understand where they're coming from, so I try to just, come from a place of understanding and help them get that we're on the same team. We're thinking
Yeah.
about their child as a priority, and so once you get on their level, pretty much, it's much easier, I would say.
Hmm.
Yeah.
Yeah, that makes sense. I always try and show like, this is all for your kid. Like this, we want them to be comfortable, right? And I don't know. Sometimes I feel like if they want a certain thing where it's like, well, we came here because we want our kid to be sedated, and it's like, well, your kid's 6 years old, and we only sedate kids at this office over here, not here. And it's like now I'm like the bad guy, and I can't. I don't know. I thought that makes sense. The rule is we don't sedate it.
Yeah. I know. Sometimes they have something else in mind, but I think for the most part, when you actually explain it well, they get it. It just takes some time, because they have something else in mind. So it takes some time for
Yeah.
them to adjust.
Yeah. Which dental school did you go in? Remind me.
I went to NYU for dental school and for my residency as well.
That's right, because I knew we had met way back in the day at
Yeah.
NY.
I still have you in my phone as Brendan OS. I should change it now.
Nice.
Dr. Gallagher.
But just Brendan. That's best. Did you always knew you wanted to go into peds?
Always, since 8th grade. I had quite a
Really?
journey with the dentist myself.
Tell me about this. Let's go.
So, growing up, I had a lot of cavities growing up. Petrified of the dentist. Very scared. And then one day, I chipped a tooth, one of my primary teeth. I was on a hammock. I saw a cicada, like a shedding of a cicada. Jumped off the hammock, chipped my tooth, and then there was this one dentist that was open on that Saturday, close by. So it was this pediatric dentist. And before that, I had been going to a general dentist. She was great. Very calm, patient with me. I had been pretty scared from my previous dentist and my previous dental experiences, I would say. So over time, she really helped me change that fear into passion and interest. She'd give me a mirror. She'd help me, she'd really be patient with me, and I would watch procedures. She'd let me watch procedures that she would do on my siblings. So I knew
She would let you
that.
watch on yours. That's cute.
Yeah,
Yeah.
very cute. And I want to do that for other kids, I see a lot of kids who are very scared, and
Mm,
I really resonate with that. It's not fun going to the dentist. It's very vulnerable.
it is. Yeah.
So I get
You
it.
can't see anything that's going on too in your mouth,
Yeah,
right? Yeah.
exactly.
And then, so you knew all the way through. Where'd you go to college? Did you kind of pick your college on the trajectory towards dental school?
Yeah, so I went to Adelphi University. They had a fast track program with NYU. So I did the 7 year with Adelphi.
And we were actually talking about this previously. Did you know Bianca Camarda from Adelphi? I don't know what year she is. She's a pediatric dentist now, so I was like, oh, maybe you guys, from Adelphi to. She went to Stony Brook Dental School though.
Maybe if I saw a picture, I would recognize her. I'm not sure. Yeah.
Oh, that's funny. That's funny. Oh, so what's something I wanted to ask you about, like sedation with kids? Do you feel like, because it can be a very traumatic experience, did you ever get sedation when you were a kid and you were going to the general dentist office that was like a very traumatizing experience for you? That
So I was very scared of the dentist, but I listened and I sat there and I kind of took it. I'd be the one with silent tears. Very anxious
man,
before, but I would follow directions. I actually didn't even use nitrous when I went to the pediatric dentist, and I spoke about it with my dentist later on. And I said, it's so interesting because I was so scared. I'm curious why I didn't get nitrous. And she's like, you were great. Like, you didn't need it. It's a different experience thinking back, being in the chair than from the outside looking at me as a patient. Because I was coming off as scared, but very cooperative.
right, right. We give the nitrous to kids who are a little less cooperative, or they just want it. Like, I don't know. I think it's fine
Yeah,
too.
I think I would have been a candidate for nitrous for sure.
Why? Why? I'm curious. I'm curious. What's your kind of like algorithm to say patients better with nitrous, patients better with which is local, patients like better sedation? You know what I mean?
Well, I don't remember if it was given to me as an option. I don't remember my mom being told, "Oh, do you want like the nitrous for her or not?" But my main goal is for comfort in the chair. A lot that we do, of course, it matters and it's important, but we want them to be happy and we want them to be coming back. And I think nitrous is a good tool when and it can only help so much as well.
Mm,
So it's an
mm.
anxiolytic. And so, yeah, I think even if you're a little anxious, it should be an option to be more comfortable.
Absolutely.
Yeah.
Yeah. And then you crank it up too much, and then it becomes it causes anxiety, right?
Yeah,
Some
you really
patients.
don't need much. You really don't need much.
Do you guys do sedation in your office too, or just nitrous, or?
I personally sorry, nitrous or no nitrous. I personally don't do sedation, but there are people who offer it in our office.
Yeah, the pediatric dentist who you ended up seeing later, and was the first time you really kind of felt more comfortable at the dentist. When was the last time you said you went to see her and meet and see, like, I guess you met with her later on? Did you try and work at her office?
It's been a while. I should reach out to her again.
Yeah.
She was great. Yeah. Her name's Dr. Catherine. She's great.
What do you know? What town she's in?
She was in Roslyn. I'm assuming
Rockville.
she's still there, but yeah.
Is that far from where you are in the city?
I do want to be in the city.
Oh, got it. So you want to be in Manhattan?
Yeah.
Okay. Huh. Yeah, that makes sense. Easier commute. You probably wouldn't have to drive very
Yeah.
much anymore.
I do love driving, but I think I'd like to be a little bit more local for my job.
And you said Levittown. How far is that from?
Levittown is okay, so Comac would be like an hour and a half commute. Levittown's an hour and 15 to an hour and 20.
Man, I was gonna say definitely over an hour with the traffic like that. So literally every day, four days a week, you're just driving away. I feel for you. That's a lot. That's a lot of time just out the window.
It's a choice, that I made, but yeah, we'll see what happens. I do utilize my time in the car pretty well, I would say, learning and listening to music and just having a good time. I try to do my best, but it's not permanent.
And it's not forever. I was gonna say it's not forever. So, do you think you would do if you could pick a dream schedule, Monday through Friday, Monday through Thursday, Tuesday through Friday, weekends? Would you work? You wouldn't work weekends, would
I
you?
work some Saturdays actually when I'm around. Yeah.
How do you like that?
I love Saturdays. I don't know why. It's a shorter day. It's usually 9 to 2 or 8 to 1.
Okay.
And I feel productive. It feels good. And
Hmm.
I don't do it all the time, maybe once a month about.
Levittown or Comac?
Mostly Levittown for Saturdays, but anyway.
So not as far, thankfully.
Yeah, and Saturdays there's less traffic.
Here's another thing I want to ask you about. What kind of guided you into pediatrics? Was it always just since the beginning, when you were 8 years old, into pediatrics, or was there anything in dental school that was kind of like, you know, I really don't want to look at root canals anymore or something, whatever, right? And you're like, let's go. You know what I mean?
It was pediatrics or nothing for me. I only wanted to be a pediatric dentist. Dentistry alone didn't really do anything for me. But again, from my experience, I just wanted to help kids in that way. That was it. I will say, though, during dental school, I loved my oral surgery rotations.
Really?
It was fun. I love doing extractions.
No way.
I mean,
Yeah.
my extractions are very different than yours, but I think they're fun.
How are they different in your terms?
I mean, the primary teeth. It's much easier.
Yeah, they come right out.
Yeah, they fly.
Except for when those damn roots fracture off. Are you kidding me? How often do you get those when you're taking out like one of those?
Not often, honestly. Not often. But
No,
it happens
really.
here and there.
I think the two worst when it's like it's always that mesial root that's like very divergent. It's very thin. They usually come out pretty easy afterwards, but there's always that one every couple months you get like one where it's like it would be either K or T, right? And it's that mesial root that just gets locked in there. You know what I mean?
You can tell beforehand when it's going to happen. You just look at that X-ray and you're like, yep.
Well, a couple years ago, I wasn't able to look at X-rays like that on pediatric teeth, and it's just like, God, why does this keep happening?
Those teeth want to stay there, that's for sure. How many
Like,
plexos do you do?
I've been doing them like, did I have it? I didn't have any today. No, I didn't have any today. I would say most days I have at least one. I see a lot of pediatric patients in the practice. Yeah.
How do you like that?
It's okay. It can be difficult when like I don't know. I feel like sometimes parents can just be they have a totally different thing in mind. They want what they want. And now I'm saying like one out of maybe 50 is you know what I mean. It can be a little bit challenging.
Yeah.
And you try and say like no, this is for your kid. Like your kid's moving and screaming, and I'm not going to like put a needle in their face and it go into their eyeball kind of thing, right? Like, look, if your kid's uncooperative and they won't use the nitrous, they're denying that. What else can we do? We have to upgrade to a sedation and maybe send them to a different office or a certain day that we're trying to plan for the future. But that's been the biggest challenge. Most kids, 9 out of 10, are fine. It's really nice when you have parents who are willing to kind of like, no, come on, we're gonna do this. I'll hold your hand and we're gonna get this done.
Yeah,
And then they hold my hand and we get it. I'm kidding.
I hold their hand sometimes.
You hold the parent's hand?
Oh, no, the kid.
It's just a joke,
So sometimes the parents need it more than the kids. A lot of times, actually.
right? Have you ever had a parent just completely vasovagal collapse, like
Almost.
just pass out?
Almost. He was getting pretty deep.
That's like scary if they hit their head or something.
Usually the moms are okay. It's the dads.
Dads, it's always the dads, right?
Yeah.
It's always the dad. Come on, dad, go in the waiting room.
So funny.
Oh yeah, do you usually keep parents in the room when you do
Yeah.
procedures?
If I was a parent, I'd, want to be able to be in the room. I don't know if I would probably want to be in the room, but they should all have the opportunity, in my opinion, unless it's a situation where I talk to the parents. I'm like, look, I think they're going to be a little bit more cooperative if you're outside of the room. And usually it's just a conversation that we have and they agree anyways. So, but yeah, I think that they should be able to see what's going on.
For sure. Teach me though, what kind of situation do you recognize where like a kid is usually going to be better, more cooperative if the parent's out of the room? Do you have like a criteria?
And it's just based on experience with that specific kid. So like if you get a reaction out of their parents, and that's a little bit obvious. Sometimes the parents will come up to me and be like, look, I think they're better with me not in the room. And I'm like, yeah, I agree. Let's try it without.
So I need more. These are kids that you've like seen time and time again, I guess you're saying.
Yeah, once or twice we've tried. And I can see how they act with the parents. Sometimes it's less so of the fear, it's more so that they want to get a reaction out of their parents, or they want kind of attention in that way. So their behavior will be poor just because of that. And if their parents are not there, they're not.
There's no reaction of it. Yeah.
Yeah.
That's a really good point. Yeah. We've been trying to just kind of like have parents wait in the room. If they ask and are just so adamant on it, absolutely they could stay in and be part of the procedure or whatever. But then I would like kind of like recruit them and say, yeah, of course, why don't you stay? And you could kind of help us just make sure that, your son or daughter is okay, is calm and comfortable.
Yeah.
Yeah, because I mean, this is only like my 8th week in practice, and I'm trying to do everything to keep kids comfortable, and so yeah, that's why so many questions for you, honestly, there in that regard, just to make sure balancing the patients and parents. Was that always something for you?
Dealing with the parents and the kids, you mean? The dynamic.
Yeah, at the same time and the dynamic.
Yeah, I think a lot of times it takes more energy sometimes to deal with the parents, not in a negative way, but sometimes they actually need more attention than the actual patient
Right.
because they really do, and they should know what's going on, and they have a lot of questions, which are valid. But yeah, a lot of times they're a lot more scared than the patients themselves, I will say.
Yeah, I had that today, actually, now that you mention that.
Yeah.
Do you have any crazy stories with the patients and parents' experiences? Like anything that comes to the top of the mind?
I mean, I've
Something
had
funny?
some patients and parents yelling at each other. Usually they're funny. Usually it's not negative. These kids are so funny. It's like the highlight of my day working with them. It's the funniest things come out of their mouths. I can't even remember right now, but every day it's something different. They're singing, they're dancing in the chair. It's just so fun. Really.
The singing, too. I get a lot of the singing on the Nitrous.
How
Have you had that?
cute. And sometimes I'm like, can you sing some songs for me? Like, so we're going to guess what songs you're singing. And they're just cracking up. It's amazing. Today, I shared with you the trauma that I saw today.
Well, yeah, yeah. Oh my God, I completely had missed
No,
that in
don't
between
worry.
the surgeries. I'm sorry about
No,
that.
don't worry. And she was on the nitrous during the treatment, and she was just cracking up. I was doing a spec, and she was just cracking up the whole time. It was amazing.
That's the best.
I
That's the
love it.
best, where
She
they're
was
just
so
laughing.
cute. Yeah,
And she didn't feel a thing?
great. Yeah, she had a blast. That's the goal.
Pretty good.
I didn't think that you can have like that fun of experiences at the dentist, and that's what I'm trying to do.
Some people love it. My fiance loves it. She
Yeah,
loves going to the dentist. I'm like, okay, all right.
that amazes me. Really, I love that.
When you started going to the pediatric dentist when we were younger, did you start to like to go there at all, or was it still kind of just the trauma kind of
I was always
carrying on?
anxious to go because I didn't know what they would find on the x-rays. I mean, I never had a root canal or anything like that, but I've had quite a few fillings. And so I was always anxious in anticipation of what the x-rays would show. But, over time, I got more comfortable there, and I wouldn't say I looked forward to going to the dentist ever, but I was definitely
Mm.
less fearful, extremely less fearful.
That's fair. That's fair. Yeah, like who really looks forward to going to the
A
dentist?
lot of kids, you'd be surprised, they
Yeah,
come in and they're like so excited to be here. Their parents were talking about how they couldn't wait to come. It's really cute. It's
that's
different.
adorable. Yeah.
It's different than what I've experienced, but I love it. So cute.
You ever get those kids? They're coming in. They're like, "I'm ready to slam this nitrous right now."
No, they're like, yeah, I want the gas.
Yeah, yeah. I want the gas. I want the gas. I had that. I had that yesterday. Yeah, the kid really wanted the gas, and then also he put it on, and just start singing. Yeah, one of the singing kids. That's always great though when they come in, they're happy and they're happy leaving. Just had some teeth removed.
The best is when they're just sitting there laughing, and I would never be laughing in their situation, but that's so funny. How was your
What are your
experience
favorites?
growing up?
What was that?
How was your experience with the dentist growing up?
Pretty good. My one of my mom's best friends was a hygienist, so I would just go to their office. It wasn't like she would do like the cleanings. I remember once or twice had the sealants placed. My mom was always on top of me, like always brush your teeth, always floss once at least once a day, and so it all kind of it came together there. But it was like I would go to the dentist office, and I was like, sometimes you're with the hygienist more than you're with the dentist. So I was just with her the whole time, and she made it very like like I knew her from home. So growing up, that was for years. That's kind of how it went. It wasn't. It was just like, oh, going to see Aunt Janet. Like, all right.
It's chill.
It was. It was chill. It was chill. I've actually never had nitrous. I've never tried nitrous. I don't, have you? Have you? You've never had the nitrous, but you think you were a candidate?
Easy.
Yeah.
I know. I mean, we had the opportunity in dental school. I don't know why I never did. But yeah.
You don't want to get caught like Kanye with the nitrous.
Yeah, no. But I don't know. I mean, I'm curious. I guess eventually I'd try it at some point if the opportunity comes up at the dentist, but I haven't, surprisingly.
Hopefully, it doesn't come up. Hopefully, you don't need
Yeah.
to be trying the sedation too. Have you ever had sedation? Did you get your wisdom teeth removed?
Yeah, I had IV.
Me too. What did you think about that?
It was funny. I was just loopy and funny after. It was fine. It was a great experience.
You weren't like afraid to go to sleep at all?
It was a little bit, but it just happened so quickly that I
Super
went to
quick,
a
right?
consultation to get my wisdom teeth taken out, and I was with my dad, and I was like, Dad, I have a feeling I'm just gonna get it all out today. Sure enough, I had five. He's like, I have an opening. You want to just do it today? You haven't eaten anyways. And I was like, sure. It so happened so quickly, I didn't have time to think about it, which is good
Yeah,
for me.
yeah. So just like boom, 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 done, out of sight, out of mind kind of thing. You said five. You had five wisdom teeth. Is that what you
Yeah, I
said?
think I had two on my upper right.
You had a little,
Mr. Den.
little extra buried treasure up there.
How many have
I
you
always
seen? I've heard, there could be quite a few. Someone said they've seen up to 9.
nine. Oh no, I've never seen nine. I've seen like two maxillaries on bilaterally, and then, so that would be what, six. I've seen six, maybe seven. I've never seen nine.
I know 9 is wild.
That is wild. Oh man, you know what the worst one is? Is the third root on the mandibular molars.
Hmm.
Those ones are first they're like in there like cement, but and then the lingual one goes right through the cortex down into the submandibular space, but or the mylohyoid space, but
Oh my goodness.
for another time. But oh my god, here's another thing.
Yeah.
When I had to take out, this is like 2 weeks ago, had a kid with orthodontics on, so the wires are on, but we had the primary teeth that we had to get out, and obviously we got to avoid the orthodontic, the brackets, the wires, and everything. But what happens when you do, and then something comes loose within 2 to 3 days, and then you get blamed for hitting the wire, the bracket, things are loose now, sticking into my daughter's cheek.
I mean, things happen. They could just go to the orthodontist and get it fixed.
Yeah,
I mean,
yeah.
look, that hasn't happened because I usually like to. It's difficult because sometimes the wires are really tight there, so it's hard to get the forceps. But the orthodontists are usually chill. They're like, if you break it, you break it. You can cut it if you want. Just have them come back and we'll put it back on.
And they'll put it back on.
You
Some of
had a
these mothers, I'm telling you, I'm telling you.
You know,
Bad review. Oh, well, I'm gonna get this surgeon on the online. The typing away.
these things happen
Yeah,
because look, I think that for us it's common sense. Like you just go back to the orthodontist. It's no big deal. No one really cares. But when you have a situation like this, I guess it just teaches you to be extra, extra cautious in the beginning and let them know, look, this could happen beforehand. If it
I do
happens,
that.
oh, you did
Because
better.
you know how it is at NYU. Like we do the sedations on kids, and we do the premolars, we do the impacted teeth, the mesiodens, we do the premolars for the. So I know that already. I do it. I go over with everything. I don't know. It's been a weird. Could be patient pool. Could be patient pool. It's been an interesting experience in the first 8 weeks where it's like, I don't know. It's a certain thing, but yeah.
It takes, yeah, especially in the beginning, you're not used to it. So it's like the parents they get to you sometimes.
Yeah, yeah, it could be an interesting because you have the best in mind for the patient, and it's like I don't know. There were three instances, right? So out of what, like I'm seeing kids all day, every day too. Like it's actually a fair number. Like I'm seeing at least 3 to 5 a day, I would say. So I don't know. But
Right, you
anyway,
like kids?
I don't mind it. I like cooperative kids
Of course.
or kids that like give me the gas, crank it up. But yeah, so we got to look for an opportunity in the city, right? Somewhere a little bit closer. No, because I feel for you. Like 3 hours lost in a day is that's just like. Do you ever feel like that could be like, I don't know. I don't want to be like. Do you think it could be leading to burnout in the future?
Again, it's not permanent. So if this was like, where I'm going to be, yeah, that'd be a little wild for sure. But because I just remind myself that this is what I'm choosing to do, and no, at one point it was leading towards that. I was getting very tired in the car, but there are things that you can do to change that. Just
What have you? What's one of the tricks? Give me some of these tricks.
getting more sleep, being intentional about what, I used to not eat breakfast. Now I eat breakfast. And it's just small things. Yeah. And I think your mindset is the biggest one. So if my mindset was, this is really making me tired, of course it's going to make me tired. But if my mindset's like, I'm going to use this time in the car to get things done that I wouldn't do otherwise, obviously while paying attention to driving, so things that I'm listening to, phone calls, if I think about it in a more productive way, that really does help.
Mm. What? I have two questions for you. What do you eat for breakfast then? You were talking about breakfast.
Oh, it's different. I love hard boiled eggs.
Really? The stinky hard boiled eggs? Those ones?
Yep. Protein packed, stinky, hard boiled eggs.
True, true. And when you're having breakfast, isn't that in the car or is it before you head
In
in?
the car. I'll eat in the car. I
Man, so
don't
you're
really
just
eat that
stinking up the
much.
car?
What? Yeah.
I'm just messing, just sticking up the car. You open up the door into the parking lot. Like, hey, kids.
Yeah, I'm not really picky about what I have. Recently, I've been getting bone broth and drinking some bone broth on my way. Right now, this is bone broth.
Is it really? Bone broth is great for you too, and it's packed with protein, right?
Mm-hmm. It
I would
tastes
not.
great.
It does, right? It's like soup.
Yeah, I'm getting sick, so I have my tea in one hand and my bone broth in the other.
How are you feeling, by the way? I know you mentioned you were feeling
Good.
under the weather.
I think I can still fight it. Let's see.
I hope so. I see where you're going with the mindset. I love it.
Yeah, right? It works.
I never would have guessed you having bone broth. That's
Yeah,
good for you. It's so good for you.
yeah. So that's gonna be my breakfast tomorrow too.
Just bone broth or bone broth with smelly eggs?
Just been done. It's one or the other.
Oh, okay. Just one or the other. All right. Question number two. The things you were saying to be really productive in the car ride. You were saying phone calls. You were saying what you listen to. What's like the perfect car ride? Because, I mean, if it's an hour and a half.
So the perfect car ride is a podcast and then music on the way there. I don't really. Sometimes I'll talk to people on the way, but it's usually early. And then on the way back, a bunch of phone calls, maybe finishing up a podcast, and then it's time music.
And what time do you have to get all the way out there
So every
in
day is
time?
different. Mondays I usually work 8 to 4. Tuesdays I work 9 to 5. Wednesdays and Thursdays I work 10 to 6.
Wednesdays, Thursdays, 10 to 6. And which day is the Levittown day?
Monday.
That's the 8 to 4.
Yeah, so
Okay.
I'll wake up at like 6. Not that early, honestly. And then Tuesdays I'll wake up around 6:45. It depends if I'm working out in the morning, but usually Wednesdays and Thursdays I'll work out in the mornings if I even get to
Wednesdays,
it.
Thursday.
Cause yeah. And then yeah, Wednesdays, Thursdays I'll wake up depending on what I'm doing in the morning, but around 7:45.
Pretty good. Pretty good. If you could fit all that in before you go in Wednesdays, Thursdays, you get the workout in,
Yeah,
you get there and you're done when you get out of work.
ideally, doesn't always happen. I still have to live my life a little bit.
It can be so tough. It's like sometimes you look at the hours and like, an easy 9 to 5. I'll get it in beforehand.
Yeah,
It's just, especially when you're living on your own now, right? Like when you're in the city or whatever, just living on your own, it's like there's just so many responsibilities. I think that's something that I definitely underestimated when I was younger.
yeah. Do you work out in the mornings?
I would prefer to. I just feel like, I don't know, like right now I'm trying to study for boards in the morning. And I put up like posts in the morning and stuff. I don't know. It's like you got to knock out things for the day, and then after work, it's like it might not happen as far as whether it's the gym or doing other things or commuting.
Yeah, there's a lot to get done in the day, right?
So much to get done. What's the number one podcast you're listening to right now?
I switch off. I like Huberman Lab a lot.
Oh, that's a good one.
On Purpose, I love On Purpose. I listen to yeah, a whole bunch.
Call her daddy.
I actually don't, but
No,
I've seen some of her interviews on YouTube. But yeah, I like to, if you have any recommendations, I like to change it up.
it's tough because like a lot of these podcasts are very. I don't know. I feel like everyone has like very niche podcasts. I like Huberman Lab. I listened to him on. I don't know. I forget if it was Lex Fridman's podcast or the British guy's podcast. And Huberman's good. I really like him.
Yeah, he's good.
He's a little bit like, is it Alex Hormozy, but with a very like more of a science based
I don't
approach?
know if I know Alex.
He's the guy with like he kind of looks homeless, but he's like jacked. He's always in a flannel shirt.
Does he do a podcast with somebody else? Is he a co-host?
He might. He might. I don't watch his
Okay,
podcast. I
maybe
don't.
he
So
needs to.
I'm not sure. But yeah. That's really great for the rides. But hey, so just to wrap this up, last questions. What do you think is something that if someone's interested in pediatric dentistry, they could be thinking about? So you've been thinking about it for a long time, right? So I was thinking of this question to ask you in terms of like, you're in dental school. What's kind of like how do you recognize that pediatric dentistry is for you or, any specialty for that matter? Or specifically, in your case, how do you recognize that earlier on, if that makes sense?
For me, I'm very lucky. It was just a feeling, and it was something I knew. It was like a no question. This is what I'm gonna do. This is something I fell in love with at an early age. Very lucky to have had that opportunity. Um, and then I didn't think about it much. It wasn't like, oh, I need to do this for this. It was just something that I trusted would happen. And it did. Whatever had to fall in place fell into place. I think if you realize it during dental school, it's something that you have to love working with kids. Behavior management is key. And, the dentistry you can learn as long as you have to love doing dentistry as well. But that's kind of like second nature when you're a pediatric dentist. You're doing so many other things while you're doing the actual dentistry. So, keeping it light and fun but also really having a passion to work with kids. Yeah, passion with working with kids and really caring about their oral health is the most important.
You're not kidding. Doing like so many hats, doing so many things at once, entertaining the kid, distracting them, cleaning their teeth, putting a sealant on, extracting that molar, doing the class 1, class 2, and at the same time, yeah, mom, everything's going on.
I'm having a conversation with mom while entertaining the kid. I don't know what I'm saying half the time. I'm saying gibberish, but they love it. Really, I'm talking about what color I'm painting the tooth or what I'm finding in their tooth. Chocolate. I tell them I find a lot of chocolate in their teeth. You gotta clean it out, and they're cracking up. I guess they ate for lunch. It's so funny. It's really fun.
You take it. What is this? A turkey sandwich today?
Yeah.
Yeah, I like that one.
I'm like, give me a thumbs up if I guess your lunch correctly, and I go through all the possible lunches I can think about it while I'm doing my treatment. It's fun, and me and my assistant, we have a really good time.
You gotta have a good assistant, right? And they gotta play along with it too. That's a good point.
Oh, we have a very good time together. Yeah, it's very fun.
Good assistant. Have a good team. Yeah. Yeah. All right. You got to do me a favor. You got to contact Doctor. What was her name?
My pediatric dentist, Dr.
Yeah.
Commute, for sure.
Got to contact her. Like just I don't know. You got to follow. Like I want to know how it goes. Like contact her, see how she's doing, see if hey like opportunities, but then also if she knows anyone closer to the city area that might align with something that you're looking for. I want to see that come true. It's killing me thinking that you're driving 3 hours
Yeah,
a day.
it'll happen.
You
Don't
know,
worry. But yeah,
it will.
thank you.
I'm pumped. I'm rooting for it. That's why I want to see that through.
We're neighbors now, though. We gotta milk it.
Yeah, yeah. We got to get these going. We could definitely do like a pediatric sedation day, like once a month, where we just plan like 10 kids that just need IV sedation to do things. And that's actually an idea where we could do all restorative and
Under IV.
under IV, all restorative, any extractions. Get it down to just one surgery. We plan like a big day. That's actually something we can consider. We'll have to chat about it.
For sure. Yeah.
All right. Hey, thanks for coming on. This was fun. This was a good chat.
Thanks for having me anytime.
Yeah, and good luck tomorrow. Commute. Good luck with. You're gonna find a good spot. You're gonna find.
For
It's gonna be
sure.
good. I hope I get to see you in the city soon. Through Sean, Lauren,
Oh, I'm
etc.
sure. Well, we have the party coming up
Bingo. That's right. That's right. I got that in the calendar.
pretty soon. I'm excited to celebrate together.
So I'll see you there. Yeah. Yeah. We'll have a couple shots or a drink or something.
For sure.
All right. You have a good night. Okay.
Thanks. You too. Nice talking.
You too. All right.